Okay, good morning. So today I'm going to just demonstrate about IV infusion priming the IV bag. And so here we have the Alaris pump, which many hospitals use these days. This is also called as a smart pump because it can keep you safe. It can keep your patient safe from any medication errors regarding the infusion rates and stuff. Anyway, let's get started. So first thing that you have to do is make sure that it's always plugged in. Although it has a battery life, you want to make sure that you have plugged it whenever you can. So first thing you do is system on. So there's a little button there. I don't know if you can see that. So system on, and then you answer the questions which comes up on the screen. So the first thing is new patient, yes or no, and you have to press on the arrows on the outside. You don't press directly on the screen. So new patient, yes, and it's asking medical surgical patient. I'm saying yes, and then it asks for the patient ID. So here it's preferred to put in the account number of the patient, which will be on the patient's label. So I'm just putting a random number over here, 52363. Confirm the number with your patient's label again, and then press confirm here. So now your PCU or your brain of the Alaris pump is ready. So once we prime it, then we will use the infusion channel or the infusion pump. So just to show you, there's a little button over here. So you have to press this in order to remove this. So you press this and then you can take that off. So there's a little, you have to go at an angle to put it on. And you can add as many as you want on either side of the pump. So if you want to put this on this side, you first have to hang it like sideways. And then you have to press it until you hear that click. Okay. So as I said, you can put it on either side, and the main computer, which is the brain of the PCU of the pump, will recognize according to the channels which are fixed on either side. So now let's get on to priming our line. So this has a small tear on top. Almost all IV bags will come with a little there's a lot of water there. Anyway, so that's the bag, and it's always better to hold it upside down like this, and so you have a firm grip on the opening over here, and you have to open that. So before we open that, we have to open our tubings here. And for the tubings, these are specific to the Alaris pump, and there's a small serrated markings over there, so you just have to pull that up and take the tubings out. So the first thing, whether it's a secondary line or a primary line, first thing what you want to do is to clamp the roller clamp, because you don't want fluid to come out of the tubings before you're ready. And then you can take off the other binders which are on there. And there's a small plastic tubing here which keeps this part straight, which actually goes into the pump. So you take that off, and then there's a small protective covering on the spike there. You have to take that off, and again hold at the neck over there, and then pull the small rubber covering which is on top. Now spike the bag with you have to push it in like really hard. Make sure that you don't puncture the sides. That's very important. and it always helps to hold at the neck over there because it is thicker there, and it will also help to direct your the spike into that. Okay, so once that's done, you hang it. And you have to take care that these tubings doesn't touch the trash can, or it shouldn't fall on the ground, because then you'll have to change all the tubing all over again. So now what you do is fill the chamber here like half full so you can see it drip, and then direct it to trash can, or you can direct it to the sterile bag if you would like, and open the roller clamp so that all the air gets out of the tubing. So once all the air has come out of the tubing, make sure you don't have any air bubbles. And you can wait to take the cap off the end of the tubing until you're ready to connect it to the patient. So now we are ready with the tubings. We have primed our bag, and now we have to fix it into the infusion channel. So again, we have to remove this. So you go here and open the lever, and you start with this part, with the straight part that goes on top of the Alaris pump over there. And then there's this little projection here, you have to push it in. So you have to push it in, and then with your finger try to push the tubing into the small lip which is at the bottom over here, and then close it. So when you close it, make sure you're not this plastic part is outside the pump, the door, and then close it. So now you're ready to go. So after this, you can connect this to the patient. You can take this, you can take the cover off and then connect it to the patient. Of course, you will follow all standard protocol as to wiping the IV port before you connect this. So that goes without saying. So now we have to program the pump over here. So first thing, anything you want to do with any channel on the IV pump, you first press or select channel select. So when you do that, on the screen it will say A. So if you had like 4 pumps, whichever pump you press, it will show up on the corner whether it is A, B, C or D. So channel select, and then you go to guardrails IV fluid. So whenever it is mentioned guardrail, it means there is a safety mechanism into it that will prevent you from increasing the rate or putting in the wrong rate and things like that. So always try to go in for the guardrail selection. So channel select, and then go to guardrails IV fluids. So there's IV drugs, which means all the drugs, all the medications, antibiotics and all that. And IV fluids have all the maintenance fluids as well as the blood products. So here there's a choice. It says half normal saline, and normal saline with 10K and all that. So we have normal saline 0.9%. So I click on this arrow outside the screen. And then it's asking normal saline 0.9% was selected, is that correct? And it is correct, so I press yes. And then it's asking for the rate and the volume to be infused, which is VTBI, and the rate. So again, I press rate, and then I put in here, the order says 100, so I'm putting that 100, and VTBI is 1000. Now 1000 ml, if you put the whole 1000 ml, this will become dry, since all the fluid will go out, and then you will have air in your tubing. So you want to avoid that. So I would put 950 or 975. So I'll put 950 here, and check again, make sure it is the numbers are what you indeed want, and then press start. So when you press start, anytime you see this color, the orange color, it means that something is wrong. The IV fluid is not running. So you have to find out what's wrong. So what's wrong? We have not opened the clamp. So then you have to open the clamp. So the red means that it's completely blocked or it's occluded. And many times it will tell you what the problem is. If it's the patient side or there's air in the chamber or anything, it will tell what the problem is. So you fix what the problem is and then press restart from the side pump here. And as long as it's green, it's good to go and we are good. So it will keep showing up, it will keep telling whether the rate, the volume, how much it's infusing, and also what fluid is running. And of course follow all the other the rest of the standard protocol regarding documentation, and you always make sure that the IV site and everything is good, and that is it. That is for the primary tubing and the IV pump in relation to the using the maintenance fluid. I can do channel off and I press channel off. Oh, most of the pump also has the silence button, which you can, if it's beeping, you don't know what's going on, you don't know what to do. So there will be a red which is missing in here. It's silence, and most of the pumps in the hospital will be in red or yellow color or orange color. So if you don't know what's going on, just press the silence button so it'll not drive your patient go crazy, and then find out what's going on or tell your nurse that it's beeping and what